Hi, this is Dr. Mike Simber with
Decoder.
Today's code is 92132, which stands for Scanning Computerized Ophthalmic Diagnostic Imaging. We know it as anterior segment OCT most of the time. So for this code, it reimburses about $29 in central Pennsylvania. As with all of these codes, it requires a written order and interpretation. The frequency can be up to 2 times per year. If we think back to the narrow angle spectrum, we remember that there are 3 classifications: primary angle closure suspect, PACS, primary angle closure, PAC, and primary angle closure glaucoma, PACG. Under a primary angle closure suspect, the most common code that you'll be using is narrow angle, H40.033. For primary angle closure, you might use a code like H40.063, which is primary angle closure without glaucoma. And then for primary angle closure glaucoma, PACG, you might use codes like acute angle closure glaucoma, H40.213, or chronic angle closure glaucoma, H40.2231. In addition to all of those codes that I talked about, sometimes you might use open angle with borderline findings, high risk, the H40.023. Now, you cannot use low risk, as we often use for glaucoma suspects, because that will not be reimbursed for this code. In addition to all the glaucoma codes that I've mentioned up until this point, there are a couple other pathologies that would warrant doing the 92132, and that would be corneal scars and opacities, corneal edema, or even after corneal transplant. In summary, 92132 can be billed up to twice a year. It will most often be used on the narrow angle spectrum, but also can be used in the management of corneal disease. Remember, billing and coding can be complicated. I want to make it as easy as possible for you.
Decoder.